Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy, and good afternoon, everyone. Today we have no new cases of COVID-19 in Nova Scotia, but we do have 4 active cases. All are connected to travel, and all are self-isolating as required. None of these cases are connected to New Brunswick, and we are monitoring what is happening there. Dr. Strang will have more to say on the cases from New Brunswick. But as of today, we are not closing our borders to any other province in Atlantic Canada. And tomorrow, my cabinet colleagues and I will take the final look at the COVID Alert app, and we'll have more details to share with that following cabinet. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. As always, I'll start today by giving an update on our COVID cases here in Nova Scotia. We have no new cases to report today. Since our last briefing on October 6th, we have announced 3 positive cases of COVID-19. 2 of the cases were related to travel outside of Canada, and the 3rd was a close contact of these initial 2. All of the individuals are self-isolating as required. None of these cases are related to outbreaks in New Brunswick. So as of today, we have 4 active cases of COVID-19. 1 of them remains in the ICU. And our total numbers to date, we've had 1,092 cases of COVID-19 in Nova Scotia. 102,273 Nova Scotians have been tested and had negative results, and we've had 65 deaths. And yesterday, the Nova Scotia Health Authority's lab completed 401 tests. Since last week, New Brunswick has been reporting an increase in COVID-19 activity, specifically in the areas of Campbellton and Moncton. What we're seeing in New Brunswick is an important reminder that COVID is still here and how quickly it can rear its head and create significant numbers. It's a reminder that we must not become complacent simply because we've gone long stretches with very few or no cases here in Nova Scotia. I am in regular communication with my Atlantic Chief Medical Officer of Health colleagues, and my team within public health is monitoring the situation closely. In our discussions with New Brunswick, our colleagues have told us that the cases are in known facility, family, or social group clusters. They have not identified community spread at this time, and there is no evidence of increased risk to people traveling to or through these areas in New Brunswick. As a result, we are not planning any changes to our border protocols or restrict travel between New Brunswick and Nova Scotia. But as I said, we will continue to monitor the situation. Like all Nova Scotians, people who have recently traveled to or from Campbellton or Moncton are encouraged to monitor their health and completely online self-assessment if they become unwell. And anyone traveling to these regions or other parts of Atlantic Canada, like all Nova Scotians, we ask them and remind them that they need to follow and treat the public health protocols with diligence. This includes physical distancing, adhering to mandated gathering limits, mask use, hand hygiene, and regular cleaning of common surfaces, and staying home when unwell. We can't say that enough. Those are the tools we have. Then we need each and every Nova Scotian to continue to follow those, whether they've traveled outside of the province or not. That is how, if there is an introduction of COVID here, that is a key at how we limit its spread within our communities. But I think it's important for people to understand the situation in New Brunswick. There is no evidence of community spread. There's no evidence of increased risk within the general community. There's no need for increased restrictions of travel in New Brunswick, but we continue to watch that very closely. I'll move on to Halloween now. We've got a topic, certainly, but the amount of questions I'm getting is clearly a topic top of mind for a lot of people. But you know, now that we've gotten through the Thanksgiving weekend, people's focus is shifting to Halloween. And I know while many people are looking for advice for trick-or-treating, I also know that as much, if not more now, that this time often brings adults together for Halloween parties as well. I know it's the adult parties which, quite frankly, give me more concern than trick-or-treating. So I'm going to start by giving some guidance on Halloween parties and events. And all this information is going to be up starting tomorrow on our coronavirus website, but I think it's important using this opportunity through you, the media, to communicate this to Nova Scotians. So before attending or hosting a Halloween party or event, it's important that people assess their personal risk level. What is their own health status and age, and what level of risk they be themselves or people within their family for a severe disease, a COVID disease, and make their choices starting based on that. And then also thinking about what they need to do to keep the rest of their family and their community safe. Again, we need to understand all the things I just talked about, the tools we have. It's important we continue to apply those even when we're celebrating something like Halloween. Certainly, if the individual hosting the party or someone in their household is feeling unwell or they're required to be self-isolating for one of a number of reasons, they should not be hosting a Halloween party or event. And certainly, anybody who's been invited to a party on Halloween, if they're unwell, they should not attend. And just like any other gathering, it's critically important that people adhere to the gathering limits. So people can continue to gather within their family or close social group of up to 10 without physical distancing. And I'm strongly encouraging that anyone who's going to celebrate Halloween, that they do it with their family and close friends within a group of no more than 10. If people are having a Halloween party at their house, the limit they can have in a house is 10. If they're at a larger event in the community, just a community event, then the maximum number of people at a community event is 50. And if an event is being run by an organized business or organization, a recognized organization or business, then they can have up to 200 people indoors or 250 people outdoors. And it's important that people remember within those numbers of 50, 200, or 250, that the physical distancing rules must be maintained. You can have groups of up to 10 within those larger groups that are family groups or close social groups that don't have to maintain the physical distancing. So the gathering numbers and the physical distancing requirements are critically important. Along with that, we also need people to be, again, monitoring their health, following things like hand washing, cough etiquette while they're at these parties. If people are required to, reminder that if any of these events are in indoor public places, and that includes restaurants, bars, other community spaces, that there's a requirement to wear an a non-medical mask if it's an indoor public place. Halloween masks do not replace the need for non-medical masks. Most Halloween masks cover will have holes for breathing. They don't serve the same purpose. It may sound simple, but just because you're wearing a Halloween mask doesn't replace the need for you to wear a proper non-medical mask that properly covers your nose and mouth. And again, it's also important to practice the hand washing, cough, sneezing etiquette, and regular cleaning of common touch surfaces. And especially at these events, it's not the place or the time to be sharing food and drink. It's okay to serve food and drinks if the rules around physical distancing and good hand washing are followed. And if people do choose to offer food or drink, then they need to have either someone who's a designated server or serve it in a way that people can have pre-served out portions that then individuals can come and help themselves. What we don't want to have is have a common service, so everybody's hand goes on, for instance, a serving utensils, or on a large bottle of something that people are pouring into their own glass. It either has to be one person serving or pre-served in a way that people can then come and help themselves. That's critically important. So parties can happen, but they have to happen under strict requirements of limiting numbers, ensuring adherence to physical distancing, non-medical masks, and all the other public health protocols. Now for trick-or-treating. There's no reason that trick-or-treating can't happen this year. but it's not going to be exactly like trick-or-treating in previous years. So there's things to think about if people are, or if you have kids in your family and your kids are going to go out trick-or-treating. Certainly, again, if the kids are unwell, as disappointing as it may be, if they're unwell on Halloween evening, then they should not go out and be trick-or-treating. They certainly can go out and trick-or-treating with, family members, with their close friends. But again, no more. The group limit is up to 10, no more than 10. And if there are, many neighborhoods have lots of groups of kids going around, so if the kids are out and about in their group, they need to stay at least 2 meters away from other groups. If they're out on the street, keep that distance. And if they're lineups for getting to popular houses, then the kids just need to make sure that they know that they need to wait their turn, keep that 6 feet or 2 meter distance. It's perfectly okay that people, if they choose it, especially every year, but especially this year, people they don't feel they want to participate, households in trick-or-treating, or they're not able to. But what we're recommending is make that very obvious. So turn off the lights, don't have anything on your front porch, etc. Make it very clear, even if you put up a sign. And then you won't have people, minimize the chance of people actually coming to your house. We're really encouraging families to do trick-or-treating outdoors. That's not possible for everybody. People live in apartments, etc., but as much as possible, we know the outdoors is much safer than indoors. And if people are doing trick-or-treating indoors, I would encourage them, especially that the kids be wearing a non-medical mask in those indoor spaces. And it's even more important, again, keeping those physical distancing spaces. It's really important we tell our kids that we should not be taking treats. If somebody puts out a bowl of treats and everybody's hands going in the same bowl, tell your kids just take a pass on that house. And I'll get to how people should serve out treats in a minute. But the last thing we want is, like the food service for adult parties, we don't want multiple hands going in the same container, if you will. We're asking kids to, don't shout or sing loud voices. Keep your conversations low and quick. If you're at the door, rather than ringing the doorbell or putting your hands on something, a quick knock on the door with the knuckles will be fine. But don't put the hands on teach your kids, no hands on the doorknob, no hands on the doorbell. Just a quick rap with the knuckles. Again, stopping the virus is going to be mostly on this part of our hands, not as much on the knuckles. And then also, if you're especially with younger kids, if you're out and about with them, bring some hand sanitizer. Have them washing their hands throughout their trick-or-treating time. And when you get home, it's really important that the first thing you do, have your kids, is wash your hands. Before you do anything else, wash hands. You don't need to clean, disinfect, or quarantine any of the treats, but what's, again, is critically important that the hands that they're going to then start to eat all that candy, put it in their mouths, that they're clean hands to do that. What about households? How do they then do trick-or-treating on giving out treats? How do you do that safely? Again, if somebody is unwell, they should not be out there giving out treats. It should be either somebody else in the household who's feeling well, or just don't do it at all. Again, if you're choosing not to participate in Halloween, make it very clear. So if you're concerned about people coming to your house, make it very clear that there's no point in coming to your door. Turn the lights off, put up a sign, etc. If possible, we're encouraging people. Hopefully, we have a nice evening on Halloween. Get outside, sit at the top of your driveway, sit on your porch, whatever. Or even if you're in an apartment, have the door open and sit there. And rather than having everybody knocking at the door. If you're not able to do that, then I would encourage you to frequently just have some alcohol, hand sanitizer wipes, and be wiping down your doorknob and if you have a doorbell. Even though we're asking kids not to do that, but just that cleaning will help. If you want to have hand sanitizer there for the kids, that would be good too. We would ask you to try to have one person giving out the treats, and find ways to give out the treats that are not having multiple hands going into the same container. So either you have pre-served, as individual packages that are laid out on a table somewhere, or maybe you have a bowl and you have tongs and you're handing them out, but do it in ways that minimize multiple hands touching things. And again, we would encourage you whoever's giving out the treats, wearing a non-medical mask. And we're asking the kids not to be singing and shouting, and certainly don't be encouraging kids to do that. As I said, all this information will be up on our website starting tomorrow, and we're using our social media to remind people of all of this. I'm going to finish off by talking very quickly about influenza, our other favorite topic. It's important that we have as many Nova Scotians as possible that get the flu vaccine this fall. We need to minimize the chance of both COVID and influenza spreading at the same time and having a significant impact on our healthcare system. So flu vaccine is being distributed to doctors, primary care nurses, and pharmacists this week. Flu vaccines at no cost to Nova Scotians will start to become available through all these providers, as well as in some rural areas, public health clinics. So people can start to make arrangements starting next week to get their flu vaccine. We're asking people to be patient. Every year, there's always a rush at the start of the campaign. You have to, from now until Christmas, is my saying. You have about 8 weeks to get vaccinated, so we don't have to rush and everybody get vaccinated at once. We have no influenza here, so we have a period of time. So let's be patient. We have lots of flu vaccine. You will get a chance to get immunized, but we have to have more requirements this year because of COVID. Everybody needs to be having an appointment. We can't have large clinics, so it is going to take more time to get people vaccinated. So we're asking both providers and the public to be patient. You have up until Christmas, from now until Christmas, about 8 weeks. So you don't have to rush. So just a reminder, there'll be more coming, lots more information coming out next week, both to providers and the public, but I just wanted to let people know that they can anticipate and start to make plans starting next week for flu vaccination. Premier.
Thank you, Dr. Strang. Chrissy will be happy to answer any questions.
Just a reminder, one question and one follow-up with reporters in the amount of time that we have for today. First question will go to Mike Gorman with CBC.
Dr. Strang, you've talked about why you're not overly concerned, I guess, about what we're seeing in New Brunswick at this point. You're not issuing travel advisories and that sort of thing. But I wonder if you could just expand on that a bit, because as you do or do not know, there are some businesses here that are already saying to folks, if you've been to Moncton recently, please wait 2 weeks until you come in. They're trying, and other people are concerned about whether or not they ought to take a shopping trip to Moncton or visit friends who are in Moncton, that kind of thing. So I wonder if you could just expand a bit on this notion that based on what you've seen so far, there isn't a need for people to be alarmed about what's happening.
And my conversations with New Brunswick, and this may change, but to date, there is nothing that would suggest that there's general exposure in the community. In Moncton, all the cases are directly linked to the long-term care facility. They have identified 2 community exposures. There was the health authority did a public release on this. There was a Costco optical, and then there was a restaurant. They have not had any cases identified by people coming forward from those possible exposures. So every case they're seeing they're able to carefully link back and show it's directly related to exposure within the group, the known group. The same in Campbellton. There's several smaller groups within the large outbreak, but so far they're able to trace all those cases back with a direct link back to one of these initial events. So what that show, and the people that, when I was talking to them yesterday, that the people that they're turning positive are the people they expect to see positive. So when we have a case of COVID in a household, we fully expect that other people in the household are going to turn positive. So what they're seeing is what's expected as how COVID spreads. What they're not seeing, fortunately, is people unexplained cases. That there's no way to explain their exposure. So there's nothing to suggest that if you or I travel to Moncton or to Campbellton tomorrow, or we were there or Thanksgiving, that we're putting ourselves at any increased risk of COVID exposure at this time.
When you look at the idea, and maybe both of you could talk about this, because ultimately, Premier, it's your decision, but Dr. Strang, you're advising the Premier. But when you look at even the consideration of having to make a change at the border, how difficult would it be to even get to that point, given how many people we have passing back and forth between Amherst and even Sackville for work or other purposes, and just the general flow of commerce and things like that? Is it even realistic to think that we could have some type of substantive change at that border?
I mean, certainly the logistics of that would be difficult in terms of the volume of people, and we'd have to actually, certainly if it's not all of New Brunswick, but certain parts of New Brunswick, we'd have to then go back to stopping individual cars and saying, where have you been? So there's a lot of logistic issues. There's also lots of impacts on economic impacts. So we need to look at all of that and say, is there a reason to do that? And so far, I'm very confident that talking to New Brunswick, looking at their information, there is nothing that would suggest that there's a general increased risk of COVID. What it is a reminder about how quickly COVID can enter a community and then start to spread. That's important that it reinforces our message of why we have to maintain our vigilance and not get complacent. But I think, kudos to New Brunswick. They've been able to identify cases early and stop that community spread by identifying contacts, testing them, isolating the contacts. That's exactly the approach we will have. But again, there's nothing at all that would make me go to the Premier and say we're at a position now that we need to consider tightening up our border with any of our Atlantic colleagues at this point.
I think it's also, if I can, it's important as we look at the Atlantic region and the success in some ways that we've had. That's been by following public health's advice, and I think the fact that in New Brunswick, while the number of cases are startling for those of us here, just hearing the raw number, Public Health in New Brunswick, in conjunction working with Dr. Strang here, have identified where those outbreaks are coming from and where the source of the outbreaks are. And we need to trust the advice of Public Health and what we've been doing. And I think it's incumbent on all of us, those of us who are neighbors to New Brunswick, to continue to be good neighbors. Continue to make sure that we follow the science, follow the advice of public health, but do it in a way that's kind, remembering it wasn't all that long ago we as a province had a number of outbreaks, and we found our way through it, being able to isolate it, track it, and that's what we'll do with New Brunswick. It's our goal in Atlantic Canada, of all premiers, is to ensure that we have the movement of our citizens within inside of Atlantic Canada, as we've been doing now for the last number of months.
Next question will go to Global's Jesse Thomas.
I guess as we're seeing the success here in Nova Scotia of the cases, we're doing our part, and I think everyone in the Atlantic bubble wants to do their part. But it is concerning to see what's happening in New Brunswick. So I guess with regards to the COVID-19 app, we understand it's near. But I'm just wondering what maybe the holdup is and when it could come about and how that might be successful, and if we see further spread throughout the bubble.
There's been work ongoing between both the national government and our government. That work is being finalized. As I said in my opening remarks, I'll be talking to my cabinet colleagues tomorrow, and I'll have more to say on when that'll be activated. But I think it's, we wanted to make sure, and I think it's fair to say, Dr. Strang, that when this was being talked about, we wanted to watch what was happening in neighboring provinces, particularly Ontario, that when the app came out, what was the, what was the uptake in terms of testing? Did we have capacity to be able to deal with that? You've heard us talk last week that we were going to be increasing our own capacity from 1,500 to 2,500. That is unrelated really to the app issue. We just want to continue to ramp up our testing in case there is a second wave here, or to play an active role within the Federation to provide testing for some provinces that have obviously feeling the pressure. But we're confident that with the app that we have capacity to deal with any increased testing that would be required.
Just make an additional comment. I think the app is a good thing, but it's not like a golden ticket. It's just another tool, and I think that the key message for Nova Scotians will be that when we get it up and going, use the app, but by no means should the app be used to replace all the public health guidance around staying physically distanced, stay in small social groups, use your mask, wash your hands, etc. I think that's really important that we push that out, that the app does not replace all the other public health measures out there. It's just one more little tool in the toolbox that together helps us control COVID.
Jesse, go ahead with your follow-up.
Thank you. I was just going to shift to the conflict and the tension between the Indigenous and the non-Indigenous fishers in Digby. We're now seeing it get violent. I think, you know, the footage last night was disturbing. And I'm just wondering, Premier, your voice here is needed. I think your leadership is needed now. I know from the Indigenous leaders, they want to hear from you. What are you going to do about the situation?
So we've been very consistent through this entire situation. It is incumbent on the national government to have Indigenous fishermen and non-Indigenous fishermen at the table at the same time. We all know the Marshall decision 21 years ago talked about moderate livelihood. In the 21 years, no one has been able to define that. It's critical that they sit down with all sides of this issue to talk about what is a moderate livelihood and how in that process are they preserving and protecting the stock of this fishery so that it'll be there for Indigenous fishermen and non-Indigenous fishermen in communities across our province. But it is the national government that has to have everyone at the table. It is one of these issues, quite frankly, that the conversations are happening with individual, whether it's a DFO working with non-Indigenous fishermen by themselves or working with our traditional fishery by themselves. We need everyone at the table to be able to find out what is a workable solution that makes sense for everyone and preserves the Mi'kmaq's right that the courts have clearly laid out, and at the same time reassuring our traditional fishermen in this province that they have that fishery will be there with sustainability in mind while respecting the law.
Next question will go to All Nova Scotia's Devin Stevens.
Premier, this morning WestJet announced they were essentially gutting the service to Atlantic Canada, and the CEO kind of blamed the Atlantic bubble for that. Wondering, A, what you make of that statement, and B, how concerned you are of the economic impact of that service change.
First of all, let me say WestJet has been a tremendous partner for our province and, quite frankly, the region. Over the last number of years, we've seen tremendous service. They've been forthright, direct, having great conversations with them as we did leading into this. This is a big blow to the region. We know that Air Canada also made a decision early on to make changes. WestJet is making those changes. This, in many ways, is how we move around this region. At the same time, it's how we go to the world. We've had great success in tourism numbers. By no small measure, it's been the routes that we've added along with WestJet and Air Canada. We've seen the growth in our export opportunities. It's been air. We believe the national government needs to be at the table to recognize that in order for us to recover economically, our greatest success of recovering economically after COVID will be with a vibrant air service. That will include, in our region, both Air Canada, WestJet, and others. But we remember the day when there was no competition in Atlantic Canada. That is not where we want to go back to. No one anticipated COVID. No one anticipated the impact. We're supporting other industries at the national level. This is a national issue. And it's our view that we need to find a solution to this. Because otherwise, our climb out of the economic impact of COVID will be much greater than other parts of Canada. We need this service.
Go ahead with your follow-up, Devin.
I know it's tricky because public health drives the bus on this, but when you hear a statement like that, does the government consider modifying or looking at the Atlantic bubble, and are you looking at any other economic development measures to offset this at this point?
First of all, the Atlantic bubble is one small aspect of the decision made by WestJet. The fact of the matter is, Canadians were not moving for a period of time. We're seeing some change, but that's one aspect of it. Public health and the health of Nova Scotians and Atlantic Canadians will all be always at the forefront. I think it's incumbent that anyone that has the privilege to be the premier of one of our respective provinces always has to make a decision in this moment in time based on public health and the health of our citizens. But I want to go back to what I believe is our way out of this economically. We need a vibrant air service. This region needs a competitive air service. It's not good enough that one survives. We've all lived through those days. The cost of a flight from Halifax to Sydney, Nova Scotia. We could travel halfway around the world on a cheaper air ticket. We saw changes when we had that competitive environment, and you know, I'm obviously disappointed with the announcements by both our major carriers over the last number of months, but I think it highlights where we need a national strategy about air transportation. It is absolutely critical that we put together a strategy to ensure that we have air service, multiple air services in this country, so that when COVID is over, we can recover and build economically, and whether it's through tourism, whether it's through our exports, or quite honestly, whether it's business travel. What a difference it has made when you could get direct flights from Paris and Glasgow into Halifax, not having to fly over our province into Toronto or Montreal and fly back. We saw a big difference in that. We need this service up and going, and I'm looking forward to the national government to continue this conversation so that these two services will be here. They'll look very differently in the beginning at the end of COVID, but quite frankly, they'll be able to rebound, and if we as a national party and national governments put strategies around making sure that happens.
Next question will go to CTV's Natasha Pace.
Premier, the Halifax Chamber of Commerce is wondering if restrictions could be loosened more in Nova Scotia. They say even something like perhaps slightly adjusting the physical distancing required in elevators could allow people to go back to their office buildings. Is there any thought to that?
We can, on one hand, celebrate the success that we're having of keeping COVID aside and then having people tell us, well, let's change the rules. We can't ignore the fact that we were one of the first provinces to put on masks first. And the impact that's had in positive health, the same keeping our distances. So I would strongly encourage the business organization to ask themselves this question. What happens if a second wave comes to their members? What happens if Dr. Strang and I have to sit here and say we're closing businesses again? What would their members think of that? We're asking people is to actually take what I don't consider inconveniences, but they are in some people's mind inconveniences: wearing a mask, keeping 6 feet distance, washing your hands. While the outcome, and while you may not have the same benefit to your bottom line as you would have before, a year ago, we need to be mindful of the fact that this virus is still here. Our neighboring province is showing us this virus is looking for some place. And I, in all good conscience, could not stand with ask Dr. Strang to loosen up on public health protocols, knowing that when the ones we're doing are working. And that's the position that we will continue to say, and we'll be consistent on that until we have a vaccine and see the way that we can function with this virus.
Go ahead with your follow-up, Natasha.
Yeah, just on that note, there are also the approach that New Brunswick takes with the phases, like the orange phase or the orange level. They're wondering if there could be something clear-cut like that put in place in Nova Scotia. So if there is a second wave, businesses will know at what point they may have to shut down, and they would sort of be able to have a plan in place or have more of a clear direction. Is that something that you guys are looking at?
We're actually, my team is actually working on that. I had actually a large call with the Economic and Labor Council last week that the Halifax Chamber was on that. We talked about this in detail. We emphasized the importance to them of, that at the time, and the Deputy Minister of Business, Bernie Miller, was on the call as well, that we emphasized the point that actually good public health is good economics, that if we can stay where we're at and minimize any subsequent wave, we're actually able to get to an economic recovery faster. So I think, so we're making the point that actually sticking with where we're at is actually good economics as well. And loosening is not the thing we need to do. We also talked to them about, and we're going to do in the coming weeks, as my team is developing what we call this walk-back plan. So if we start to see increased cases, how might we start to increase public health restrictions, whether that's in one community or broader But I think I'm always mindful of having a framework that allows us to do that, and so we'll bring that forward for some discussion with these different sectors, because they said give us a chance to give you some feedback, because they may have some creative and innovative ways to keep their business open but still allowing the appropriate level of COVID safety, if you will. So I'm very open to having a conversation with them about and hear their creative ideas, but my bottom line is always, are we achieving the right level of safety? At the same time, I'm always mindful of that of whatever we put down on paper needs to have enough flexibility. You can't have a concrete plan and go phases that everything's all figured out, because everything is about context. How are the cases happening? Where are they coming from? How are they spreading? And so we need to have whatever walk-back plan we have needs to be a broad framework that allows us to have the right level of flexibility to respond to the actual circumstances. But we are going to be bringing something forward, first within government and then with our sectoral partners, that would guide us of the steps we would need to consider if we get an increase in COVID-19.
Next question will go to News 95.7, Chris Halef.
Yeah, this question's for Dr. Strang. It's just going back to not closing the borders. We're not closing them at this time, but I'm just wondering what specifically you would have to see in New Brunswick before the province seriously considers restricting border access. Is it community spread and community spread alone?
I think we'd have to see that there was a significant risk of COVID being imported from New Brunswick. The same rationale we have of why we have the Atlantic bubble. We've all agreed in Atlantic Canada, both the chief medical officers and the premiers, that there's enough of a risk of COVID coming into the Atlantic provinces that we need to have those border restrictions. So it would be the same thinking and analysis that would go on that would bring forward for consideration of going, if you remember, at the very beginning of COVID, we had our Nova Scotia bubble, if you will. We weren't talking about it at that time, but even within Atlantic Canada, we all had the border restrictions. So there'd have to be a substantive risk, because, as the Premier's talked about, there's a lot of benefits, and it's like I've said many times here, that COVID is all about a balance. You have to balance the appropriate levels of COVID precautions, but also understanding that everything you do has its own set of impacts. And our goal is to have an overall minimizing the negative impacts, both on COVID responses and any restrictions you have to play. So it's always looking at both sides of the equation and finding out what is the right balance of things.
Go ahead with your follow-up, Chris.
You've obviously had time to take a look at what's happening in New Brunswick. It's unfolding as we speak, and time to analyze it. I'm just wondering, from your perspective, what have you seen there that, perhaps mistakes that may have been made over there, that you want to ensure that we don't make the exact same mistakes here?
So I wouldn't call it mistakes. It's almost inevitable. They've had some introduction of COVID from people coming in from outside of the Atlantic bubble. We've had that as well, but we've been fortunate not to have the same circumstances to lead to the level of spread that they've had. So it's not this is inevitable. We will get. I keep saying we will get further introductions of COVID here into Nova Scotia, and our job is to make sure that we have things in place that minimizes the spread. New Brunswick has done when I talk to them and I look at what they've done a very good job. They've identified a case early, identified an outbreak early, have moved in, and as I said, they're identifying the cases, the contacts, doing the appropriate testing, keeping those people isolated, minimizing the chance for it to spread more broadly in the community. That's the same approach we would take. So as I talk every week with the Atlantic Chief Medical Officer colleagues. Our epidemiologists are talking on a regular basis. All through COVID, we've been sharing, and we'll continue to learn from New Brunswick right now, is how they've responded and what they're learning from their current clusters, and how we then how that informs Nova Scotia, PEI, and Newfoundland.
Next question will go to Tim Biscay with the Halifax Examiner.
Premier, I'd like to return to the situation in Digby County. I understand, and I think everyone agrees with you, that the federal government has to do something about the context of this. We do have, however, an immediate situation, and last night the level of violence was disturbing. I guess my question is two parts. Are you concerned that the RCMP has enough resources in the area to deal with it, and do you have anything personally to say to the non-Indigenous fishers about their behavior?
I've never, at any point, would suggest to anyone that violence of any kind solves any issues. It actually creates tensions that are much greater than the situation started with. So I would ask all citizens in this province, Indigenous and non-Indigenous, to recognize as we work our way through this that cooler heads need to prevail. I recognize the anxiety that each of you may be feeling when it comes to the way you create a livelihood for you and your families. All the more reason why DFO needs to have a meeting with both sides so that we can all hear each other's points of view. When we're operating with half-truths, stuff we're reading at different times, people's motives being characterized by somebody else, as opposed to all sitting down and being able to express ourselves directly to one another, we're going to create a situation that we have. I think it's incumbent, though, that the national government and DFO quickly pull together a meeting that brings all sides together to find a solution that the courts told us 21 years ago we needed to find. And that has to happen soon.
Go ahead with your follow-up, Tim.
I guess you missed the RCMP part of that. But moving on, last time we spoke, you said, and the Justice Minister said that the Glenasue matter, that you would ask CERT to look into it. It's been a couple of weeks, and I know they said they were going to quickly respond, but I haven't heard anything. Has there been any word back from CERT to you or to anyone about their intention?
I don't know whether it has gone through back to the Justice Minister, but not to me.
Next question, we'll go to the phones, to the Canadian Press. Keith Doucette.
Dr. Strang, I'd like to revisit the idea that most of these cases that are coming in, despite the Atlantic bubble, are through international travel. We seem to be catching them and tracing them at this end. But how are they still getting through the system when they enter the country? Has there been any thought into looking into that, and have we pinpointed any potential problems in our overall screening nationally?
So I wouldn't assume that they're all just international travel. It's a number of our cases have been in travel in other parts of the country as well. But we continue to have discussions, certainly at the tables that I'm at, the Special Advisory Committee. We have regular presentations from the federal colleagues around their Federal Quarantine Act and their border measures. And you continue to work with them to make sure that we're having the appropriate flow of information and the consistent approaches on screening, etc. Right now we're working with them very closely on how we might bring international students into the province with the right oversight of quarantine, whether it's for universities or private language schools, even some of our K-12 private schools. So I think I just use that as an example of the ongoing collaboration between the province and our federal colleagues around all the different agencies that are involved with bringing people into the country. Ultimately, my job is to be at the table with my team and make sure that the right things are in place to protect those people coming in as well as protect Nova Scotia.
Keith, go ahead with your follow-up. Keith, are you there?
Sorry, yes. Go ahead. I was just wondering what the second part of my question, too, then. Is it safe to assume that we are catching them with the frequency that we need to at this end in terms of what we already have in place? Are we confident in the system that we've set up?
Well, what I do know is that when you look back once we open things up starting in June, we've had a number of cases that have been related to travel, and virtually all those cases that it's actually been people who have been following the quarantine rules, and that because they've been doing that, they've had few to no contacts when they're identified as a COVID case. Another example is our universities, where we brought over 4,000 students in from other parts of the country. successfully had them all go through a quarantine process. We had, out of all those 4,000, we had 3 people that were positive. So I think that shows that the measures we're taking, by and large, are working.
Next question will go to Nabal Snam with the Herald.
This question is for Dr. Strang. So from a COVID safety perspective, do you have any concerns about people voting in person this Saturday? And what advice do you have for them?
So we've worked closely with the the Department of Municipal Affairs, and through them municipalities around elections. We've given protocols if they do have for in-person voting, how to do that safely. It's all based on controlling numbers, keeping physically distanced, having good hand washing, make sure people are using single use of the pencil, all those kind of things that you don't have common sharing. So those protocols have been put in place, have been shared with the municipalities, so we can have in-person voting done in a safe manner.
Nabal, go ahead with your follow-up.
Premier McNeil, advocates have said that the COVID Alert app is not accessible to marginalized communities, and those are the ones that are at the highest risk of getting COVID. Do you have any plans of addressing these issues if the app is rolled out here in the province?
I think it's, as Dr. Strang said earlier, this is not a panacea. It's not a solution that will prevent the other protocols in place, nor is it a solution for everyone. But it is one of those options that we will use just to provide another chance for us to track this virus. And we will continue to look at other ways that we can support Nova Scotia citizens to keep them safe. The single biggest thing that we can all do is follow the advice of public health, ensuring that we're wearing a mask, keeping our distance, washing our hands, and stay home if we're not well, and do the online screening or call 811 to do that screening process. So if it requires testing, we can do that.
And that's all the time we have for questions today.
Thank you, Chrissy. Tomorrow marks the 7th month since Dr. Strang and I first sat here to talk to you about COVID-19 in our province. And we have been through a lot since then. Death, illness, business closing, families being separated, and it's been very hard. But Nova Scotians have shown incredible strength and resilience. Look where we are now. We continue to see our cases go down because we are willing to follow the public health protocols, including wearing a mask even when we don't want to. We were among the first provinces to make it mandatory, and Nova Scotians have adapted. You can't imagine how proud I am when I tell other premiers how well it is going here to allow businesses to reopen and allow them to operate in these difficult times, because Nova Scotians are following all of the public health protocols. And I want to thank you for that. But I can't say this is enough. We cannot become complacent. I know Dr. Strang and I sound like we're nagging. Not that we would know what nagging sounds like. But look at what's happened in New Brunswick. They've had no cases for a long time. And just like that, the virus is back. We've been in contact with officials in New Brunswick, and we've offered our help, and we feel for what they are going through. It's a stark reminder to all of us. COVID is still on the move, and it is looking for a home. So let's continue doing what we've been doing, following the protocols, wash our hands, keep our distance, wear our masks, and stay at home if we're not feeling well. And let's not forget, take a moment today to think about our neighbors in New Brunswick. They need all of our positive vibe and energy right now, because we all know kindness matters.